Good morning, everyone. On behalf of Screen and Jay and the Rutgers Cancer Institute, hello and welcome to Community Cares and Project Echo. So, thank you for joining today's session, and we hope that the information shared today will help you serve your community better. And now, just a few announcements before we begin. And I apologize, there's a barky dog in the background. All logos, text, and images used in this presentation are the property of their respective copyright owners. And please note that the information contained in this presentation is not a substitute for any medical care consultation. Always go to your physician if you have any questions on treatment or if there's something that you need help with. So today's agenda, we will have our series overview, our introduction, presentation, our case study, and then our Q&A forum, and then some final housekeeping. So the Rutgers Cancer Institute became a Project Echo hub in 2021. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And this is done by using technology to leverage scarce resources sharing. We're going to share best practices. We're going to reduce disparities, applying case-based learning to master complexity, and evaluating and monitoring outcomes. And for more information on Project ECHO, please visit echo.umnm.edu. And now, a little bit about our speakers today. So, Michelle Ashley has been an oncology nurse navigator for 17 years. She's going to do the education portion. She has worked primarily in breast and gyno navigation, assisting patients and their families through cancer treatments to survivorship. She has also worked as a nurse navigator in cancer screening and early detection for breast, cervical, and lung cancer screening. Michelle holds a Master's of Science in Nursing in Community Health and a Master in Public Health. She has certifications in oncology nursing, breast cancer navigation, and as a tobacco treatment specialist. She is passionate about navigation, addressing barriers to care, and evaluating interventions that improve cancer disparities. Our case presenter today is Courtney Lozano, a licensed social worker, and she's the founder of Mosaic Wellness Consulting, where she specializes in supporting those impacted by cancer, whether in treatment or post-treatment, caregiver or patient. Finding support during this journey can be emotional healing. Courtney also has a passion for supporting fellow healthcare professionals through wellness initiatives and professional development. With over 15 years in healthcare, including extensive work in oncology, Courtney is dedicated to helping healthcare professionals combat burnout, find balance, and nurture their own emotional well being. Through workshops and customized support, she empowers providers to thrive in emotionally demanding careers. Okay, that is enough from me. I am going to pass it over to Michelle.
Morning, everyone. It was so wonderful to see everyone joining from different parts of the country. And thank you, Evelyn, for that wonderful introduction. Next slide. Oh, I have no financial disclosures to disclose. And first, we're going to start with a pretest. The first question is, an individual is considered a cancer survivor from time of diagnosis through the balance of life. So choose one. Late effects begin after treatment and may manifest several months or years later. Researchers have identified a range of complex and interrelated factors that drive cancer disparities in the United States. So we'll be going over this information at the end of our session.
And I just want to get a certain percentage of participants answering, so we'll give it another maybe minute. Okay, we'll move on.
Slide. So this will be the overview of our presentation today. First, I'll go over what is a cancer survivor. We'll review some statistics, and we'll most importantly talk about disparities in cancer survivorship, the different guidelines that clinicians use for survivorship, care plans, healthy lifestyle recommendations, and of course, resources and what's next, like a call to action. Next slide. So survivorship is in the news. A lot of people are always talking about cancer survivorship. There's a huge patient population. Our community are cancer survivors. But what does that mean exactly? Next slide. Traditionally, people thought of cancer survivors as someone who was free of any sign of disease for 5 years. And that was sort of the traditional definition. And now we're a little bit more holistic in it, in that people are considered a cancer survivor from the time that they're diagnosed throughout the balance of their life. And this includes survivors who are living with cancer with like metastatic disease that's maybe spread to the spine or other areas, as well as those free of cancer. Next slide. We have a video here. We're going to see if there's enough time at the end, but it's from the American Cancer Society, and we'll come back to this if we have enough time. This is the latest statistics from the American Cancer Society. As you can see, there's a huge patient population across all the United States. In New Jersey, where I am coming from today through Robert Wood Johnson, our state has about 500,000 cancer survivors, and this is the latest statistics from the American Cancer Society. In terms of the highest prevalence of survivors by tumor site, for males, the top three are prostate, melanoma, and colorectal. For females, it's breast, uterine, and thyroid. So a lot of these types of cancers that are in the top ones are also ones that have screening options. So we're going to talk about how improvements in screening can also improve survivorship in these patient populations. Next slide. And as you can see here, it's kind of a little tricky to see, but basically, the number of years since diagnosis is rapidly increasing. So with time, people are living longer and living much longer lives from their diagnosis date, and the survivorship population is dramatically increasing. And why are there more cancer survivors? Basically, there's a lot of factors. This is from ASCO, the American Society for Clinical Oncology. But people are living longer. They're not dying of heart attacks and things like that at younger age. They're living longer. There's advances in other comorbid conditions. There's advances in early detection. They're being diagnosed sooner when it's more treatable, when you can just do surgery and it's not like metastatic. There's also improved treatments where there's less side effects. So people are staying on treatment. There's been clinical trials that have found treatment options that have less side effects. So people aren't having delays and barriers. And there are also newer treatments like targeted therapy, immunotherapy. Next slide. But it's not all rosy. I mean, there are a lot of disparities in cancer survivorship. And this is a lot of them are based off of social determinants of health. So social determinants of health are different things that affect people's quality of life and well-being. So some examples can be safe housing, transportation, your neighborhoods, racism, discrimination, violence, education, job opportunities, income. What do you have available in your community? Access to nutritious foods, physical activity and opportunities, polluted air and water, language and literacy. So all these things really affect survivorship. Next slide. And I like this graph. This is from the American Association for Cancer Research. They just published a document regarding disparities. And at the root of it really is also racism, discrimination, and segregation. That core leads to structural inequalities and social injustices that then affects the social determinants of health that was on the previous slide, those drivers of health. And it affects all aspects of disparities in the cancer continuum, from the development, early diagnosis, risk reduction strategies. If you don't have access to healthy food, your obesity is higher, not having access to early detection and best treatment options, and it affects the survivorship. So, the cancer treatment research workforce also has there can be disparities in our workforce as well, and these all lead to adverse health outcomes. Next slide. And certain populations experience more cancer disparities than others. So this is just some examples here, but individuals who belong to certain ancestry, racial, or ethnic minority populations, people who lack insurance or different insurance coverage, people with disabilities, individuals that are incarcerated, older adults, people who are low socioeconomic status, low education attainment, LGBTQ plus, gender minority communities, adolescent and young adults, immigrant, refugee, asylum seekers. We're seeing that in a huge way right now in terms of our patients that come into our clinic. We serve a mostly uninsured patient population at our cancer center, and also citizens of sovereign not native nations. So a lot of these population groups are experience cancer disparities at higher rates. Next slide. And here's some examples from the American Cancer Society on disparities in cancer survivorship. So on the left, we have disparities by race. So uterine cancer has the largest Black-white disparity for 5-year survival. So white women have an 84% survival rate, whereas Black women have a 63% survival rate overall. So it's been proven time and time again. This report comes out every year, and these have been consistent disparities. There can also be disparities by insurance status. So on the right, the very top line, that's the lighter brown, is a person with stage 1 private insurance, much higher survival rate compared to the line that's on the bottom, which is black, and that's for stage 2 uninsured. So there are disparities within insurance as well. Next slide. And these are a couple more examples. Black people have the highest overall cancer death rate among all racial and ethnic groups. There are higher mortality rates for stomach, liver cancers in certain Hispanic, Asian Pacific Islander populations. This one, you can read this on your own, but like rural communities have a 30% more likely to be diagnosed and die from lung cancer. Transgender women appear to be at 60% lower risk of developing prostate cancer, but they nearly have double the likelihood of dying from it. So there's huge disparities that, affect populations differently. And next slide. So now we're going to change gears a little bit. We'll come back to disparities at the very end because I have a call to action, but we're going to talk about survivorship guidelines. So these are the main ones that clinicians will use. We've got ASCO, the National Comprehensive Cancer Network, and the American Cancer Society. Next slide. And this is sort of a breakdown. So NCCN has it by topic. So there can be a lot of the chemotherapies that we give. There's anthracycline-induced cardiotoxicity. There's long-term effects that can affect the heart. It can affect cognitive function, which people call like chemo brain. Exercise, fatigue, healthy living, lifestyles, menopause symptoms, pain. It can affect sexual function. ASCO has a breakdown of their guidelines as well. And then American Cancer Society has its nutrition, healthy, by holistic care, as well as by certain cancer type. Next slide. And the survivorship care standards, the main focus of what all of these survivorship care standards are focusing on is how can we prevent recurrent and new cancers? So that's that ball on the upper left. What are the physical effects? How can, psychosocial effects from receiving cancer treatment and diagnosis? How can we help do health promotion and improve chronic conditions? So this is kind of a good diagram. I love GW Cancer Center. They have great webinars. So if anyone's interested, it was from that one. And this is one of the questions that we had. So what are some of the physical effects that we're looking for in the survivorship phase? There's both long-term effects that begin during treatment and may continue once treatment is completed. An example of that is sometimes when people receive Taxol, let's say, they might have peripheral neuropathy in their hands that start during the treatment and then continue years later. A late effect can begin after treatment, and it may manifest several months or years later. There's a lot of different examples of this one as well, such as like cardiac toxicity. They might develop it years later, or lymphedema. Next slide. And then these are some of the questions that it's important for patients to kind of, or clinicians in general, to be kind of aware of when they meet with people in the clinic. So I don't know if you guys can read it, but basically it's doing an assessment, checking in with them about their heart health. Are you asking open-ended questions about anxiety, depression, uh, sexual health? Do you have any concerns regarding your sexual practices, sexual activity, relationships, things like that? So this is sometimes what can be used in clinic just to kind of check in periodically in the survivorship phase to make sure that there aren't any effects that have developed from receiving treatment that are now a concern and they need to be addressed. Next slide. And then sometimes also people will receive what's called survivorship care plans. It's developed with the care team. It has the name, contact information of the doctors that they saw, general information about the treatment they received, such as what type of cancer they had, their diagnosis date, stage, location, what type of chemotherapy they received. And that's really important because a lot of times chemotherapy can have maximum doses that you can receive in a lifetime. So if there is a recurrence later in life, it's important to know what type of chemotherapy and how much they received earlier. It's also important, and this is an example of some of the different care plans that have that information on and can be shared with primary care doctors so they can also help manage these side effects in the future. Next slide. Oncolife also has survivorship care plans online. You can enter in this information. The patient can, clinicians can, and they have it in English and Spanish. And the website is there if you're interested in learning more. But to be honest, it's time consuming to create these survivorship care plans. And the Institute of Medicine recommended it in like 2008. And it was a standard as part of the Commission on Cancer for COC accreditation. But it's kind of gone by the wayside. In 2020, they stopped, or 2019, they stopped requiring it. And so the general questions, the important things that people really need to know about survivorship is um, these questions that are here from ASCO. So like, what other treatments will I need to receive? Who will be part of my care team? Are there online groups or resources I should be part of? If I have problems, who should I call? And often as a nurse navigator, they call me and I kind of direct them to where they need to be. Next slide. Now let's talk about healthy lifestyle. These are the modifiable risk factors. So uh, all things can kind of affect cancer risk, but these are the ones we kind of intervene on in terms of healthy living and try to modify. So tobacco smoking is one of the highest contributors to cancer risk. Excess body weight, alcohol consumption, UV radiation exposure, poor diet, different infections, and physical inactivity. Next slide. And not surprisingly, because we know about these modifiable risk factors, the NCCN guidelines and ASCO and American Cancer Society all focus on this. So these are their healthy living guidelines for survivors: achieving and maintaining a healthy body weight, being physically active, maintaining a healthy diet, limiting or avoiding drinking alcohol, following sun safety recommendations, avoiding tobacco use, and getting enough sleep. No one gets enough sleep, but ideally 7 to 9 hours is the ideal amount. And following up with a primary care doctor regularly and getting connected with the community assistance programs to overcome challenges that people face in the survivorship phase. So these are the physical activity guidelines from NCCN. Basically, they recommend being active every day, routine activities, recreation, exercise, avoiding being inactive for long periods of time, using major muscle groups with resistance 2 to 3 times a week, and stretching major muscles as well, 2 days per week on which you're not working those muscles. And they have different recommendations, but at least 150 minutes of moderate intensity or 70 or like 75 minutes of the vigorous intensity, or kind of doing a mixture of both. So on the next slide, we have a breakdown of what that actually means. So these are some examples of light intensity, moderate intensity, and high intensity. Now, one thing to think about is that a lot of times it's a unique position to be in as a cancer survivor, and there might be special considerations. So, for example, when lymph nodes are removed, especially with breast cancer patients, There might be what's called lymphedema, which is a buildup of bodily fluids. When people have had an ostomy done, which is a surgically created change in the way stool or urine leaves the body, that can also affect their physical activity. Prosthesis or limb amputation, peripheral neuropathy, that can happen after receiving certain chemotherapy agents, have tingling, pain, numbness, especially in the feet, can make it hard to exercise, and bone loss or metastasis. So it's important to work with the care team and with physical therapists, to rehab specialists, to develop a care plan. Nutrition recommendations. So from NCCN and ACS, they recommend high fiber foods. So those are really whole grain breads and cereals. Eat a diet that's at least 50% plant-based and avoiding and limiting intake of like red meat, processed meat. So that's the bacon, sausage, deli meats, pickled, smoked foods. Limiting refined sugars. And refined sugars are really those high fructose corn syrups and cane sugar. And for the alcohol limitation, women should be limited to about 1 drink per day and men to 2 drinks per day. And one other special consideration is that people who have are survivors of liver, esophageal, kidney, head and neck cancers should not drink any alcohol at all. So these are blanketed statements, but then always people should always consult with their doctors on what's right for them. And most importantly, it's really reading nutrition labels. They've updated the nutrition labels, and on the top, the one that has the yellow box, it has serving size. So sometimes people will think, oh, I'm just having this can of soup, but it's really 2.5 or 3 serving sizes. So you need to multiply it to really know what you're eating. um, there's also the calories. That's the box that is black in the center. And the nutrients that it's often important to kind of get less of are highlighted in orange there. So saturated fats, trans fats, sodium, and added sugars. And the nutrients that are good for you, that are green, are highlighted here as well, the dietary fiber, the different vitamins. And in general, if you're trying to determine if something is high in a certain area or low in a certain area, if it's 20% above the daily value, that's considered high. So if something's really high in fiber, that's good. If it's really high in added sugars, not so good. Um, and then the daily value that is 5% and below is considered more low of that nutrient. And there's also the myplate.gov has some great recommendations on how to, and recipes on how to make half your plate fruits and vegetables, and some of the recommendations. You can visit that website there. Tobacco. So it's very important that people quit smoking if they can, or engage with like a tobacco treatment specialist. So in 2020, about 12% of cancer survivors were current smokers. I think sometimes people think, why would someone smoke if they were diagnosed with cancer? It's stressful to be diagnosed with cancer. And if that's kind of your only coping strategy that you've had for 40 years, that's another thing that's hard to kind of give up. Additionally, I've definitely worked with people who have quit smoking while they were getting chemo or surgery, and then 2 or 3 years later, COVID happens, or something like happens in their life that's very stressful, and they might go back. So it's also important to not just assume that someone quit, that they haven't started smoking, and ask open-ended questions. Um, so it's never too late to stop. In New Jersey, we have these quit centers, and there's different addresses and phone numbers here where you can find your county and find the resources available to you. Next slide. And we have a wealth of resources here. So this is Mom's Quit Connection, the New Jersey Tobacco Quit Centers, New Jersey Quit Line, and this is quitting. So it's free texting and support for people who vape as well. So feel free to look at these resources. We'll be emailing this out. There's also virtual support for LGBTQ plus tobacco cessation group, and it's unique to New Jersey. It's here in New Jersey. A group meets Monday evenings via Zoom. So uh, with Inspira. So thank you so much. If there's anyone on the line who's from Inspira, for helping spearhead this. There's also a virtual youth cessation group. So it's free to ages 16 to 18 years of age who are residents of New Jersey to seek help to quit tobacco and e-cigarette use. And it meets at 3 p.m. on Mondays. Here's some information there. And this is very hard to read, sorry guys, but this is the latest in 2025. It's a screenshot of the American Cancer Society guidelines for early detection and treatment. And basically, it's important to remember that, just because someone has breast cancer doesn't mean they shouldn't be getting colonoscopies at regular ages. And as a note, sometimes genetic testing comes back and can increase risks of certain cancers. So it's always good for people to talk with their medical oncologist, surgeon, and also primary care doctor to make sure they're not in that high risk category. This, what I'm showing you right now, is average risk. Next slide. And these are resources for survivors and caregivers, some really great organizations, and they're national. These are national, so no matter what state you're in other places, feel free to look at these websites. Um, the Facing Forward Life After Cancer Treatment is a really great booklet. They have it in English and Spanish. You can download it and print it from the National Cancer Institute. And American Cancer Society is also national, so I'm glad we've got some resources here that are nationally. Um, they have this helpline. You guys have all probably used it. It's really great, and you get connected with a trained specialist who can answer questions, provide information, and they have it in over 200 languages. So it's a really great resource. There's also the CARES app, which you can download, and they have it in different languages as well. And it's 24 access to the National Cancer information staff, as well as getting connected with people who might be able to assist you so that you can scan that QR code to download the app if you like. Ever you. So this formerly used to be called TLC. And basically, it has like wigs, mastectomy products, prosthesis, different things that can help people. There's a lot of body image changes when diagnosed with cancer and have gone through this surgery and things like that. So and this is culturally appropriate. They have a lot of different other options available so that people feel their best self and keep feeling and looking like themselves. American Cancer Society also has a cancer survivors network where you can get connected to survivors, caregivers, families, and friends and post things. So they have this community available as well. Caregivers. So caregivers are kind of sometimes get lost in the shuffle, but uh, they're a huge part of supporting and being on this journey as well. So they have also resource guide videos. I reference those all the time, text them to spouses and sisters and daughters, watch this video. These are really great videos that American Cancer Society has on their websites. Crossroads for Hope. You guys already heard about this last session, so I won't go into it, but they have a lot of really great counseling, financial assistance, holistic care services, English, Spanish. So we can skip on past this. And cancer care. I text this number to patients all the time. They've got counseling, resource navigation, support groups, education, financial assistance programs. And they have a lot of different programs that sometimes you wouldn't think about, like someone needs help walking their dog while they're going through cancer treatment. They have a program for that. Um, and bereavement. Like I've worked with families because it's very holistic. You work with people from diagnosis through survivorship. If someone passes away, they also have support group and bereavement groups for their loved ones. They have camps in the summer for kids who have gone through, stuff like this. So they're a great resource. I refer to them all the time. Nice Place by the Sea, another really great. I'm a breast nurse navigator and GYN, so a lot of my patients are women who are in sore need of respite and like holistic services. We've like not a lot of resources at our hospital. So women diagnosed with any type of cancer or active treatment or within 2 years of active treatment can be participating in it. They have all these really great, this is a photo of what the place looks like, mind, counseling, expressive writing, imagery, meditation. They have plant-based meals, which can be, I had a woman who was like, I've never had a plant-based meal. I always eat meat. It's kind of a new thing to try out. health coaching, nutrition counseling, massage, reflexology, yoga, Reiki, prayer, and soul collage. Just a note, because I have a lot of patients who are on Medicaid or charity care. It is in Ocean Grove, so you do have to get your own transportation to get down there. That was a significant barrier for some of the people I've worked with, but once they get there, it's all taken care of. Aunt Bertha. This is a great organization. It's also Find Help. It's through, you can even find it through the American Cancer Society website now as well. But you put in your zip code and you can find free or reduced cost resources like food, housing, financial assistance, everything like that. So auntbertha.com is the website. GW Cancer Center, they have a wealth of resources, webinars. They have a survivorship series where you can get continuing education credit for nurses, community health educators. It's for the primary care. They have webinars on health equity, on patient navigation, for LGBT affirming cancer care, and also a fundamental training course that's good for anyone who's interested in patient navigation. So I'm wrapping it up. I've got like the last two slides. So kind of I was thinking about what's happening in the country and kind of a lot of stuff that's going on. And so I wanted to end with a call to action. So there's all these different levels. We've got the structural inequalities and social injustice. We've got inequalities in the environment, inequalities in the living environment, like in the places where people live every day. And then this all affects disparities in burden of prevention of cancer risk, tobacco use, poor diet, things like that. But all of it really affects cancer disparities. So what can we do about this? Next slide. And really, it's going to have to be a multi-pronged approach to address this core center of addressing cancer disparities. So from federal funding and organizations, academia, and like new research on cancer treatments, working with community partners, religious organizations, tribal governments. So it's going to really take a huge village to affect cancer disparities. So find your part of the pie or box, I guess, of this and get involved. There's a call to action on March 7th to get involved and to stand up for funding in these areas. Any questions or comments? Okay, those are my references.
And if you think of any questions while Courtney's presenting, please feel free to use the chat and we can go over questions again at the end.
Hi, everyone. My name is Courtney Lozano. I am a licensed clinical social worker and I've been working in oncology for many years. I just recently left a position in the hospital setting to open up my own private practice to continue to help those who are impacted by cancer, whether they're in treatment or post-treatment, and caregivers as well. And Michelle, a lot of the stuff that you discussed, I have some overlapping things, but I tell everyone about Mary's Place by the Sea, and we'll get into some additional resources too. Um, but after working in a cancer center for over 10 years, just kind of understanding not only what the patients and their families are going through, but what the actual healthcare staff is going through. And so my private practice is kind of twofold, where it's supporting patients and families, but also supporting healthcare professionals who are experiencing burnout and compassion fatigue. So today's about cancer related stuff, and I want to make sure that we can kind of move forward in that area. And I think every hospital, every cancer support, every hospital and every cancer center offers some type of support program. It could just be a support group, but there are so many different resources and services that offer more than that. And I want to go into what that means, because in addition to support, people need not only support, but like education, or they need, the wellness factor and how all of that impacts your own emotional well-being. Next slide. So we really have to consider, whether it's personally or professionally, whether you're dealing with patients in your work or you're dealing with a family member, we have to kind of really think about what is the balance between mental health and physical health, and where are we focusing? Because I think a lot of people focus on physical health, like what are you eating? How much are you exercising? How much are you moving? Putting all your effort into that. And obviously that is a key factor in maintaining your health. But at the same time, feeling emotionally, emotionally drained or overwhelmed, all of that goes hand in hand with stress. And I think, that has to be addressed in some way too. So we want to make sure that emotional support is kind of on your radar, and that the support services that we're going to be talking about today can be implemented. Next slide. So I think with anyone, no matter what you're going through, no matter who you are, having a connection with someone else, I think is just such an important factor in like the outcome of your health. So there are many programs that offer more than just a support group, and I think support groups are vital in helping people feel like they are connected. But some people are not into that, and we want to make sure that there are other services available that people can connect in different ways. So I think you mentioned that Crossroads for Hope spoke last week. There are many programs very similar to that, that they have health and wellness programs, they have social activities, they have educational workshops. And if patients are not familiar with what's available or how to get that, we want to make sure we can give them resources, because support groups are one thing, but having these other options, it's like, maintaining your own self-care and having that time for yourself to take these meditation classes or take fitness classes, and maybe try something you've never done before. Maybe you want to do a scrapbooking class or some kind of craft class that you've never done. And in doing that, it's kind of organically becomes a support group in and of itself. I've kind of witnessed, just I used to have a knitting group that we used to facilitate, and just the ladies used to come together, chit chat about what's happening. It wasn't always cancer related, but when they had a scan coming up or they had something they wanted to share, it was just an organic conversation. And that was their support group. Next slide. So any type of support, I think, is vital in making sure you feel connected. I always say you can have the most supportive spouse or best friend or someone who's helped you through no matter what you've gone through in life. But once someone is diagnosed with cancer, sometimes those people, as supportive as they have always been, they may not truly understand what you're going through, and that's not their fault. And sometimes recognizing that the people you may meet through this journey, understanding that you don't have to explain, the hair loss or the fatigue or the body image. They just completely understand. And knowing that that connection is so powerful, can really kind of help you move forward. And sometimes you don't realize how powerful it is until you are part of a group. And then I've seen these friendships blossom, and they've become like besties for life. And it's pretty amazing to witness. You can go to next slide. So there are different types of support groups specifically. So let's say someone does want to talk to someone. They do want to be part of a support group. There's a lot of different groups that can really be tailored to what they are going through. So it can be disease specific, like if they have a GYN cancer, a breast cancer, a prostate cancer support group. If they want something very specific based on what they're diagnosed with, that can be found. Based on their timeline, like maybe they're newly diagnosed, maybe they're post-treatment, maybe they're post survivor all the way like 10 years, they had cancer 10 years ago, but they're still kind of coping with maybe fear of reoccurrence or just kind of understanding how to navigate life. And there's a lot of groups in that category as well. Um, Making sure that if someone wants something based on their stage, there are a lot of groups that are specifically geared toward metastatic cancer, making sure they feel supported because they kind of have their own set of things that they're going through that are different from others too. Gender specific groups, if people want to just talk to people who are going through something exactly, what, like they just feel like they can relate, you know what I mean? Age specific, if there's a young adult group, sometimes people don't wanna, if you're like 25, I'm sure there's some, common denominators that you can relate to, like someone who's older, but there are a lot of things that as a young person, dating, all of that, and body image, and understanding that that's very specific to that age too. And then caregivers, we never want to overlook the caregivers. I think that they do so much, and we always focus on the patient. And the caregivers do so much. They're kind of going through this alongside their loved one, and they need support too. So we want to make sure that that's offered. And even if they don't want it right away, just letting them know that that's available to them whenever they're ready, that they can kind of seek that when they feel prepared. Um, Okay, thank you. And then managing difficult emotions. I think this is, a roller coaster of emotions is when you're initially diagnosed, even after you're completed your treatment. I've heard many people say, my whole family and friends were so happy that I was done, but I didn't feel that way. It's like they didn't want to jinx it, or they were just this fear of reoccurrence, or, it's a lot of mixed feelings. And whether it's anger, fear, loneliness, sadness, worry, gratitude, hope, there's so many feelings, and we want to make sure that people understand that um, that is completely normal. And I think meeting others who are going through the same thing really validates that and helps people really understand how to gain that support and how to feel connected. At the same time, understanding that who can I talk to? Maybe I just want to talk to my best friend every day and she can kind of guide me. Or maybe I want to talk to someone who's like a professional. Maybe I want to talk to someone else who's been through it. So you really have to identify what you're looking for and then be able to kind of seek that out as well. Um, Okay, so I like to, if you can think about just for yourself, like your own support system and who those people are for you. I like to think about your support system as two different categories of people. I call them the doers and the listeners. So the doers are people who would like go to the grocery store for you if you needed it, or pick up your kid from soccer, or go grab your medicine from the pharmacy. Those are the doers. And then you have the listeners, right? And everyone has strengths and weaknesses. If you think about your friends or your family, not everyone is like in both categories. They might be in one or the other. So the listeners are people who if you're just having a really tough day, like who you can vent to, who can you really talk to if you really need to. So kind of identifying in your own mind who those people are for you, and knowing like this person I know I can rely on to get my medicine or get my kid from soccer, and this one I know I can call if I'm just having a tough day. So as far as coping tips, I think there's so many programs out there that can really support people with no matter what stage they're in or no matter when they're diagnosed, but understanding that when you're at home and you're not surrounded by support, and you're kind of just determining how can I kind of create this support for myself, or what do I want to do to just kind of like a positive distraction from what's happening. And it could be anything. It could be crafts, it could be fitness, it could be writing. um, it's kind of like self-exploration in a way, where you're kind of determining what brings me joy and what's something I want to like make sure I add into my own schedule so that I can look forward to that, right? Developing a positive mindset, sometimes just having that mindset shift. I call it like balancing the happy and the crappy. So it's like we all have crappy things that happen, every single one of us, cancer related or not. But we don't want to only focus on the crappy. Like sometimes there's things that went well today. Something happened unexpectedly that was like a pleasant surprise. And we want to make sure that we focus on the happy stuff too, and kind of notice that there are peaks and valleys to our day. Um, I think, I always say laughter is the best medicine. If you want to like watch a rerun of your favorite sitcom, or watch a comedy special on Netflix, just something that boosts your mood. Sometimes we just need that. And then, bubble bath and massage, all that stuff that we always talk about. There's something to be said for that. If you feel like you want to do that, go for it. Whatever you feel like is important to you for your own self-care, you determine what that is and make sure you add that in. And we're talking about, letting our patients know about these tips too. So, I think we are our own worst critic in any scenario. We are not nice to ourselves sometimes, but we want to kind of recognize that, our own self-talk and how we speak to ourselves. And I think someone who's going through a cancer diagnosis might have just a lot of like shoulda, woulda, couldas, or all these things that they're thinking about, or how did this happen? And it's kind of like, okay, we're here. We want to move forward from this point. We don't want to think about how, why, and all those things, because it's like this spiral that can kind of get really dark, right? And so you want to catch yourself in this negative self-talk and make a conscious effort to kind of replace those thoughts with just like more positive thoughts. So for example, I always say, how would you talk to your friend, like a really good friend, if they were going through what you were going through? You know, we would be so much more compassionate and understanding with a good friend than how we speak to ourselves. So kind of understanding that our inner dialogue impacts our mood and how we kind of view our day in the world. And if we can make an effort to kind of talk to ourselves as if we were talking to a loved one, that's a great way to start. So some of these resources are very similar to what Michelle talked about. These are specific to New Jersey, some of them, and some of them are national. But I know Michelle's slides had a lot of national stuff too. So I just want to make sure that, like I mentioned earlier, it's not only about support groups where you're talking in a group. There are so many programs, and I'll go over some of them here, that have like fitness stuff. They have creative arts, they have educational workshops, and all of those ways to connect are options. And I think some people may not necessarily be aware of that. So the cancer support community, there's a cancer support community is located nationwide. They have programs all over the country. So no matter where you are, you can kind of put in your zip code and see what's close by. But they have same thing as Crossroads for Hope. They have all different programs, holistic, fitness, crafts, like all those things are really important to be able to access. Sharsheret, they're local to New Jersey as well, but I'm sure there's so many programs similar where they offer a peer matching program. So I always say that there's three different types of support. There's like individual counseling with a professional, there's support groups, and then there is peer matching. So it's like being matched with someone who has like similar cancer, has been through your shoes, and has come out on the other end in a positive way. And sometimes that is sometimes people just want the one-on-one with the peer versus a group, and that's an option too. Um, and so Mary's Place by the Sea is that great location down the shore that has, you know, it's just, I tell everybody about that place. So if you haven't learned about that, go on their website and take a look. I myself, I'm just listed on the bottom here for Mosaic Wellness. I offer individual counseling for patients and families. I do take insurance, and I want to make sure that people are supported throughout their journey. So I just want to, like, now that the weather is like a little bit nicer, it's not icy and 9 degrees out, I always want to make sure that we feel like if you can, you know, go outside, get some fresh air, have like a mindfulness day for yourself, listen to the birds, look at the sky. And so this is just kind of like a little scavenger hunt for yourself to have like a mindfulness day and just kind of notice what's there instead of, you know, focusing on all the other things that we have to do. I call it a positive distraction. It doesn't mean we're forgetting about everything else we're doing. It's just a positive way to just have a good day. So I used to have a patient who always used to use this phrase, and she always used to say, community boosts immunity. And I think that that is such a powerful statement, and it means it's so meaningful because when you are connected with others, there is so much evidence and articles and research that shows that people who are connected, they literally have better health outcomes than those who feel isolated. So in knowing that, you know, all these different classes and programs that can be available through support programs, it's just a fun way to connect, right? You're like jewelry making or making a hat at, you know, knitting a hat or learning nutrition and cooking classes. There are so many ways that you can like learn new things for yourself, but also, you know, connect with others. So I think the patients who may not be aware of that these things are available, you know, we want to make sure we can connect with that. So I used to run a cancer support program for many years, and the point of me putting these testimonials in is just to kind of make people aware that once you are part of something, realizing how impactful it is the most important part because you don't realize you're going to love it until you show up, right? So we used to have this wonderful chair yoga class, and this one woman, she just had beautiful things about it. She said the chair yoga instructor is such a special human being. Participating in her class brings out peace in my soul. I just thought that was so beautiful to hear that. Um, Someone else said, having time set aside for exercise and has also helped me with my mood. Feeling strong in my body helps my spirit as I face the future as a cancer survivor. And someone else mentioned, thank you for always providing a safe place to fall. So what I think all of that means is having those connections with others who understand, I don't think anyone who joined initially realized the special connections that they were going to have, and also the strength that they gained from some of the fitness classes. Like all of that was their own self-care and me time that they decided to, implement into their own schedule. And the other thing I wanted to mention is one of my patients, I don't know if you could see this, one of my patients um, wrote this amazing book about the cancer support programs and how impactful they were to her. And just, it was almost like a scrapbook that she made into a book. And she documented from like the moment her hair came out to the moment of survivorship and all the programs that she was participating in and the people she met and how that helped her gain hope in this whole journey. And when she wrote this book, I was floored. I had no idea she was going to do this. And there was a whole page dedicated, to the programs that we facilitated and how impactful they were. And she gave me a special copy. I felt so like honored. And she's doing well. Her kids are doing well. And it's just knowing the impact that the support programs can have on someone's journey is important to just make sure people know that these exist and to connect them if they feel that they're ready. So I know we don't have so much time, but I want to make sure that people are just aware of this concept because I think it's really interesting. So we all know post-traumatic stress. This is a concept called post-traumatic growth, which really means that going through something traumatic, it could not be cancer, it could be whatever that is, but cancer can be traumatic in many ways. And in the treatment that you go through and the side effects that you're feeling, all of that kind of goes to show that after you kind of go through this journey, come out on the other side, there are many people who feel that I've heard this time and time again. They have said, like, if I didn't have cancer, I wouldn't have changed my lifestyle. I would have never started working out. I would have never started eating better. And people feel like they have this new lease on life, right? And these lifestyle changes may not have happened otherwise. So it's really interesting to hear many people kind of share that story, and coming out stronger on the other side and feeling like they would have never felt this way, if they didn't kind of go through this, and recognizing that those meaningful connections to be able to tell other people, if you haven't said to like a long lost cousin or someone who you really haven't seen in a long time how much they have been a part of your life, or you miss seeing them, or making sure you kind of take the time to tell people how important they are to you. That's where this comes into play. That's what I've heard many times. And I always say cancer doesn't discriminate. It's like it doesn't matter who you are, where you live, what car you drive, who you know. People, there's no rhyme or reason, right? And that's really frustrating when people are like super healthy and like, I don't know how this happened. So knowing that it's kind of like when they come through this on the other side, knowing that there's a sense of strength is kind of a powerful way to look at it too. So I just wanted to make sure that we kind of reviewed all of that, but if anyone has any questions, I'm here to answer those as well.
While you guys are thinking of your questions, I'm going to go ahead and launch the post test. Um, but please feel free to unmute yourself or to ask any questions or put them in the chat.
I have a question for Michelle. When you were doing your presentation, I know you mentioned like the statistic of how many cancer survivors go back to smoking. I was wondering if there was any statistic on how many cancer survivors go back to drinking alcohol or how common it is.
Yeah, I, I, I'm sure there are statistics from especially the National Cancer Institute, that look at going back to drinking. Uh, Kind of going by what Courtney was saying as well. I've been a nurse navigator for about 17 years, and I've worked with people, met up with them years later, and a lot of times the survivorship phase, like in the beginning in the treatment, you've got so many appointments, you're connected, you're always seeing your doctors, and then when you're in the survivorship phase, it's like a free fall, like you feel like you're not connected, and people have gone back to drinking, to using drugs, to tobacco. So I don't have the statistics on me, but I can find it online and send it out to you guys.
Okay, and then here we have, thank you, Sarah, that was a great question. Um, Lee, we're going to do the poll results real quickly and then we'll get to your question. So everything was true,
Oh
and
yes, everything was true.
it looks like people 100%, 100%, that's what we love to see. So, thank you everyone. And Lee, you had your hand up.
Yes, hi. Thank you both for really excellent presentations. And the resources have just grown over the years for survivorship. I think the complication, this is just my own statement, comes in when you have a person who has a rare cancer that isn't a typical journey, as well as a population where there's an equity like an LGBTQ. So when you have multiple combinations of challenges, I think a lot of those resources become complex for them to maneuver.
You are 100% right. I agree. And there's some very rare cancers where it's only, a couple hundred in the whole United States, or, and then coupled with other marginalized, groups in our society that are marginalized. I mean, it really can be very isolating. Um, in those situations, I've asked open-ended questions about what are the most important part of their identity that they want to connect with. Some people have said, I want to connect with my LGBTQ community. I want to connect with this rare cancer. And then they build those connections where they can find it. And virtually, especially for these rare cancers where there might only be a couple hundred thousand in the whole United States, male breast cancer. I work with a lot of males who feel very isolated when they're diagnosed. So finding that support where you can get it is important.
Thank you for that. It's been my journey, so I'm familiar with it.
Thank you. Thank you for sharing.
Thank you, Lee. Thank you for sharing. Anyone else have any questions or comments, observations? If you look in the chat, our evaluation link is in there. The Mighty Links link is in there, and Mighty Networks link is in there. And also, just a shout out to NJ Seed. They provide cancer prevention services throughout the state. And a shout out to the Department of Health because it's through their support that we are able to bring this survivorship series to everyone. It is 10:59. We have time for one more question or observation in a minute if anybody has anything. No? Well,
I
thank you everyone. Oh,
oh,
go ahead.
sorry. I have a question for Courtney. Um, so I know you talked about like positive inner dialogue and like how to limit negative self-talk, but what are some ways that we can incorporate more positive inner dialogue and like specifically like limit those like negative like intrusive like self-talk that come up?
So I have something that I use with a lot of my clients called worry time, the worry time technique. I didn't make it up. It's a real thing. You can Google it. But worry time is where, we all have these worries and these things that concern us, and it kind of takes up our brain capacity for the entire day, like 24/7, or right before you go to sleep, or all these things. So you pick a time of day, whatever it is. Let's say it's 5 o'clock, and you worry for 15 minutes. And what that does is it allows your brain to have the ability to do whatever else you're trying to focus on and do all day long. And anytime you have a worry thought, you postpone it to your worry time and that worry about it for 15 minutes. And so instead of being able to like think all day long and worry, 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 you're never going to tell yourself like don't worry, because our brain doesn't allow us to do that. You're going to worry about it, but only for 15 minutes and the time that you select. So that's one option. And the other option is what is it called? Oh, the worry jar. So you put like a sticky note of all your worries in your worry jar. And at the end of the month, you open your worry jar and you realize that some of the things you wrote on your sticky note didn't even happen. So it's kind of like proving to you that worrying is basically a waste of time, but we can't stop doing it. So we want to make sure that some of those intrusive thoughts, it's kind of recognizing at the end of the day that even though we thought these bad things were going to happen, they may not have, not for all, but it's just like a really helpful way to minimize the intrusive thoughts and the worries. And that's something you can consider.
That is fantastic, and that is such a useful, practical, easy thing to do. Thank you, Courtney. So
You're welcome.
we're going to be closing up, but the conversation doesn't have to end. Again, if you have any more questions or if you want to share anything, please go to our Mighty Networks where you have the opportunity to have a discussion. It's like Facebook for professionals. We have our course there. All the resources, the recording for today's session will be there. And the report that Michelle used from AACR, I've downloaded it. I'll add that to the resources as well because I think it's a really great report for everyone to review. So thank you, everyone, and we will see you all on March 27th for shared decision making. Have a great day.